the many ailments that are increasing in our community that are causing stress to families is the discussion about fertility. It's very stressful for couples who are looking to start or add to their families when their ability to get pregnant is not occurring as it should. And some of the options when that is the case are rather expensive or rather invasive. And I think that we need to have a look at both partners in these families long before we consider these aggressive treatments, and try to understand if there are some fundamental and underlying conditions that could contribute. The men are often ignored in this conversation. A simple semen analysis will say that, well, there are some sperm and that's good enough. But I really believe that we need to help make healthy sperm. And I call this preconception healthcare. We need to look at the health of the male whose sperm production is actually taking place over a 72-day period before that sperm is actually released, and understand that we can make them better at swimming and improve the quality of their morphology to enhance the fertility in a case where it is challenged. But we don't want to ignore the men from this conversation. When we look at things that contribute to fertility and what might be adding to its increasing incidence, is definitely hormone management. And I find that it's important to understand the whole month long of hormones rather than to simply take a luteal or second half of the month test for the hormones. Using saliva as a measure for estrogen and progesterone and steroid hormones is a more accurate way to analyze the bioavailable level of these hormones that act in the tissue space. A hormone has to leave the bloodstream and migrate through the tissue and through a cell wall and act on the nucleus inside of a cell. And if we can assess that intracellular level of hormone, how much is making it to the effective spot, now we have really useful information on where we can target. I like using a herbal approach at how to assist in hormone balance before one would have to consider going to bioidentical hormones or synthetics or mimickers, because we can help the body to find its own balance again rather than adding in so much of something from the outside that now there will be other downstream reactions. Fertility is also a case of managing perhaps the social and social stresses that may be a part of it, and looking at nutrition. The patient needs to be well nourished in anticipation of that baby, and perhaps to help support a healthy milk production. All of these things are part of the holistic fertility conversation. I encourage you to give me a call or to visit our clinic. I'm Dr. Joe Clausen at Fish Creek Naturopathic Medicine, www.fishcreek.ca, to talk to us further about how we can enhance fertility and help you with that conversation, not just when it's a problem, but also for preconception healthcare planning.